Osteoporosis really means brittle bones. It's a condition which is preventable and treatable, which makes those suffering from it liable to fractures and breaks in their bones. About 1 in 2 women over the age of 50 will in their lifetime sustain a fracture from osteoporosis, and about 1 in 5 men. So it's common. For many people suffering from osteoporosis, the disease is silent, so they won't actually know they have it until they break a bone. Clearly, it can cause fractures of peripheral bones like hips and wrists and any of the other long bones, but it can also cause sudden onset of back pain due to fractures of the spine. It can also cause loss of height from those fractures and can cause changes and adjustments in the posture, which sometimes makes those suffering quite stooped. The immediate complications of any fracture are fairly obvious. Apart from the pain, they can leave people immobilised and very disabled for long periods. But most people probably aren't aware of the serious implications of something like a hip fracture. Unfortunately, about a quarter of people who develop a hip fracture, which can quite often happen late in life, can actually die from the complications of the fracture. And about a quarter of patients who've had a hip fracture will end up losing their independence. So it's not just about pain and the inconvenience of having a fracture. It can have serious implications if untreated. Bone is a living tissue which is constantly being made and broken down. As we're growing, we tend to accumulate bone, so we tend to have, if you like, more bone made than is broken down. And then sometime around our 20s and 30s, we reach what is known as peak bone mass, which is the, if you like, the most bone that we will ever have. And then over time, through aging, sometimes through natural hormonal changes, and then sometimes with a little bit of extra help from medications and environmental factors, we lose bone over time. So in osteoporosis, the balance between the amount of bone that is made and that which is lost becomes upset. So we tend to lose more bone than we make. All too often, a diagnosis of osteoporosis is made too late when people have actually had fractures, but it can be reliably made using a test called a DEXA scan. And I've prepared some other videos on this simple X-ray test to diagnose osteoporosis in a separate section. The way we know that treatment for osteoporosis is working, or rather the most important outcome, is the absence of fractures. But it's also nice to know that your bone density is improving over time. So we will usually do this by rechecking your bone density. And if you have a diagnosis of osteoporosis, you might expect to have a scan every couple of years to make sure your treatment is going to plan.